Well, good morning, everybody, and thank you all for being here. I am humbled to be joined today by organizations and community leaders who are dedicated to helping San Diegans stay healthy and do their part to help fight the flu. Joining me this morning is Mayor Kevin Faulconer, Dr. Wilma Wooten from the County Health and Human Services Agency, Rick Hazard of Waxy's Sanitary Supply, Chuck Ross of the California Restaurant Association San Diego chapter, Misty Jones, who's the director of our San Diego Public Library System, and Herman Parker, director of the city's Park and Recreation Department. The reality of how severe and dangerous the flu is was a wake-up call for my family and me back in 2014. My brother Brad, who was just 38 at the time, passed away after contracting the H1N1 flu virus. You really don't think about how this could happen to you or a loved one, but as we learned the hard way, the threat of the flu is real, even for young, healthy people. And us here are coming off one of the deadliest flu seasons that San Diego County has ever experienced. I mourn alongside the other 342 families who were personally affected by a flu-related death last flu season. But what I'm going to do here today, what I've been trying to do for the last 4 years, is turn my family's personal tragedy into action. With the generous support and donation from Waxy and Gojo, the creators of Purell, I'm excited to announce that this fall we are equipping every single library and city recreation center across the city of San Diego with a hand sanitizer station. You can see what we're modeling here that are going to be installed throughout the city. Vaccination is the most important step in preventing the flu, as you're going to hear in a moment. But giving the public more access to hand sanitizer and educating the community about the importance of good hand hygiene, which we're going to have a demonstration of later, is another important step towards fighting the flu. Our city recreation centers are used by a wide range of San Diegans, from our seniors taking classes at rec centers to kids and moms doing their homework at the library. And so if you see one of our 93 stands in libraries and rec centers, or any other form of hand sanitizer, please use it to protect yourself and your loved ones this flu season. And now I'd like to please welcome Mayor Kevin Faulconer. Mayor?
Thank you, Mark. Thank you, Mark. Thank you, Mark. Well, good morning. Thank you, Mark. And I want to thank Councilman Kersey for really spearheading this very collaborative flu prevention initiative. And Mark, your leadership has brought together key partners from throughout the region with one goal. How do we keep our neighbors healthy and stop the spread of germs this flu season? And it is truly inspiring, Mark, how you have turned the loss of your brother into a call for action. Providing these additional hand sanitization stations throughout the city, in all of our rec centers and all of our libraries, is going to benefit so many San Diegans. And I want to recognize as well the community partners, because this is a great example of community collaboration working together. Partners of Waxy and Gojo and the California Restaurant Association, who have really stepped up for this urgent need as we embark on another season. And so I want to thank also San Diego County's Health and Human Services. You're going to hear from Dr. Wooten in a second, that continue to reinforce how important vaccinations are. And so to everybody here, thank you for your time. Thank you for your generous donations, working together to reduce the spread of a potentially deadly illness. And thank you for your partnership. And I want to encourage all of San Diegans to stop, to sanitize, and to stay healthy during this flu season. Thank you very much.
Thank you, Mayor. Now to share with us the best practices against the flu is Dr. Wilma Wooten from the County of San Diego Health and Human Services Agency. Dr. Wooten?
Good morning, everyone. We are here today to talk about the flu. The Centers for Disease Control and Prevention recommends that everyone 6 months of age and older be vaccinated against the flu. People should get vaccinated by the end of October, before the flu season really gets underway. The flu season can last well into March and April, and sometimes even longer into May and June. And actually, the county monitors flu year-round, so it is in the community year-round. But again, the actual high intensity of the flu season occurs between October and April. Those with pre-existing medical conditions are more likely to experience serious complications from the flu, but healthy people, as you've already heard, can unexpectedly have severe illness that leads to disability and, unfortunately, death. The vaccine is especially recommended for people with chronic medical conditions like heart disease, diabetes, asthma, and other lung conditions. And this is even if their symptoms are under control. Pregnant women are also at risk, as well as individuals 65 years of age and older, and people who live with or care for others who are at higher risk. This season's flu vaccine offers protection against several strains, including influenza A, H3N2, the pandemic H1N1-like strain, as well as several influenza B strains. In addition to getting vaccinated, people should also do the following to avoid getting sick. Washing your hands thoroughly and often, and if water and soap are not available, then using a hand sanitizer is the next best thing. Stay away from people who are sick and avoid touching your eyes, your nose, or your mouth after touching many objects in the environment. And clean your areas commonly, because there are a lot of germs lurking on the keyboards and on common items or objects that you use day to day. If you are sick, we encourage individuals to stay home and avoid contact with others. Last year, 342 individuals died from complications associated with influenza, 255 more than the previous year. This has been the highest number of deaths that we have documented at the county since we have been tracking this particular variable. So people should get the flu. People who get the flu may be contagious for a day before they get symptoms, so they are spreading the flu and they don't even know it. If you need to get a vaccine, we encourage people to either go see their medical providers, go to our federally qualified health centers, or our public health centers. You can find the location nearest you by calling 211 San Diego or checking our www.sdiz.org website for locations. I'd like to thank Mayor Faulconer, Councilmember Kersey, and all of the community partners involved in this event this morning for getting the word out that flu is a serious illness and it can cause complications and sometimes even death. Thank you for being here.
Thank you, Dr. Wooten. And now I'd like to introduce our community partner, Rick Hazard, who's the Vice President of Marketing for Waxy Sanitary Supply. Rick?
Good morning, everybody, and thank you, Councilman Kersey. On behalf of the Wax family and the over 200 Waxy employees here, headquartered in San Diego, where we were founded in 1945, it is our pleasure to join the Mayor, Councilman Kersey, and our community leaders to support how clean hands save lives. When we hear stories and get to meet people like the councilman who have been personally affected by a flu-related death, we knew we had a part to play in the solution. As leaders in the distribution of quality sanitary supplies and equipment, we are honored to provide all 57 rec centers and 36 public libraries in the city of San Diego with a custom hand sanitizer station like the one you see here. Saving lives starts with education about good hand hygiene, and I'm excited to share with you, following this, best practice on how to use hand sanitizer. You wouldn't think so, but there really is a way to maximize the killing of germs on your hands with sanitizer. These hand sanitizers can be used by young and old alike and in so many forms, and as you see today, you can do your part to keep your hands clean and stop the spread of germs and the flu virus. Together we are fighting the flu, and thank you for this opportunity to make a difference in the San Diego community.
Thank you so much, Rick. Now I'd like to welcome Chuck Ross, who's the board president of the California Restaurant Association San Diego chapter. Chuck?
Thank you, Councilman Kersey. We are inspired by the action that our community leaders are taking to fight the flu. Today, the California Restaurant Association, San Diego County Chapter, and our 1,000-member restaurants in the city of San Diego support clean hands and healthy hand hygiene practices. As restaurateurs, we acknowledge our role in helping to prevent the spread of germs. Our restaurants and team members are dedicated to the best practices in hand washing and food handling, and the CRA is committed to further educating our restaurant members about healthy hand hygiene practices. We also want to do our part to provide our patrons with ways to prevent the spread of germs. Therefore, on behalf of the CRA, I would like to announce that we will be immediately donating 200 hand sanitizer stations to our restaurants throughout San Diego during this flu season, as well as to provide product and information to all of our 1,000 restaurants over the next 60 days. One of our top priorities is to ensure the dining public has every option to help prevent the spread of germs. Thank you very much.
Very good. Thank you so much. Thank you. Well, thank you, Chuck. That is fantastic news. We really appreciate the Restaurant Association's support and look forward to having more restaurants on board with us. I think we have about, 3,000 restaurants in the county? Or is that just in the city? So we got a lot of work to do, but part of this is really spreading awareness and making sure everybody understands the flu is no joke, and there are steps that we can take. So I want to again thank our community partners, Waxy and Gojo, the makers of Puro. Together we are able to make a difference here in our communities. So that wraps up our speakers this morning, but before we go, I'd like to bring up Rick Hazard again to walk us through the best way to use hand sanitizer. Rick?
Thank you. And as Dr. Wooten said, hand sanitizing doesn't take the place of hand washing, but augments good hand washing. So we're going to start with the proper way to sanitize our hands. So if everyone who has the single-use application, be ready. Let's get ready and crack that guy open, and we're going to dispense the proper amount of hand sanitizer into our hands. The proper amount is the amount that covers your entire hands. So you want to start palm to palm. We're going to interlace our fingers. We're going to roll our hands, get the backside of our hands while we're interlacing our fingers as well. And before we finish, we want to make sure we get each thumb. And that should take about 15 seconds. And voila, we've just sanitized our hands. Thank you.
That concludes our press conference this morning. I'd like to thank everybody for coming out, and we'd be happy to do individual interviews when we're done here. Thank you.
Thank you, Mark.
Thanks, Kevin.